Alrighty. Well, thank you for joining the January 8th, 2025 CHW Learning Circle. Our topic today is addressing cancer prevention and advocacy. For the first CHW Learning Circle of the new year, we welcome you all, and it's such great having you here. As I open up the Learning Circle meeting, I'd just like to give you an overview of our meeting, our monthly meeting. Pardon me, I'm double casting today, letting people in as well as opening and facilitating the meeting. The Minnesota CHW Alliance Learning Circle is a peer learning circle meeting held on the first Wednesday of each month, unless otherwise specified, from 3 to 4:30 p.m. remotely. It is open to all CHWs and free of charge by the CHW Alliance. The mission of the CHW Learning Circle is to provide an avenue for CHWs to connect, learn, and tap into one another's knowledge through discussion. The Mutual Learning Circle is hosted by the platform is laid out with clear organizational goals and objectives for advancement of all those in the CHW profession. The vision of the Learning Circle is to create a workforce that encompasses the voices of those in the CHW profession and support our vision of nothing about us without us. The Learning Circle is intended to be a monthly capacity building event for CHWs. It's facilitated by CHWs. At the Circle, CHWs learn with our peers as we explore issues, concerns, congratulations, advancements, and growth and such in our field. The circle provides an environment for us for which we can come together as CHWs and share our successes and concerns as we gain the perspectives of those of our peers. CHWs we know work in multiple environments and enjoy getting together and learning with each other. Because we want to learn about each other's various health settings or social settings that we may be employed through. We invite guest speakers and trainers and other professionals come in and experts to provide training on current topics, issues that you may encounter in your health field. Myself, I would like to introduce myself. My name is Angela Fields. I'm a community health worker, certificate holder since 2008. I'm also the Associate Executive Director of the Minnesota Community Health Worker Alliance. I facilitate the Learning Circle to provide peer-to-peer educational opportunities and activities. I am also, many of you may have experienced me as the student support coordinator for our CHW training program scholarship. And so today, we just want to provide the overview for the circle as a reminder as we open up a new year. It's always a new chapter, and so I like to ground us in our objectives. We understand that each organization faces unique challenges and successes, and this is which is why our discussion sessions are focused on the core needs of all CHWs. We want you to be successful in your role. We explore strategies together to increase the effectiveness of our CHW work. And scope of practice, we provide knowledge around the impact of health, and we examine the ethical concerns that we inherit just being in the CHW role. So our content this year is intended to cover topics such as our scope of practice and various roles CHWs can play in an organization or on a team. We'll talk about core professional skills and CHW character development. We will be providing those throughout the year. We will talk about and bring experts or other CHWs to talk about workforce development and engagement options and opportunities that are out there on the landscape. We'll also have health topics such as the one we will talk about today, or we'll talk about other topics around health trends. But we also provide CHWs ample time in these sessions to also speak about self-care. We talk about health education, health techniques, and for various populations across Minnesota and sometimes across the nation. So without further ado, I'm going to shift and we're going to talk about our topic today, addressing cancer prevention and advocacy. For the first time, the CHW Learning Circle is for the year. Jesus Barbera, the Associate Director of Community Partnerships for American Cancer Society, will present on the work of his organization in doing coordinated care with CHWs. I will share a little about Jesus. He is an experienced healthcare professional with a decade of expertise in quality improvement, leadership, and public health. Currently serving as Associate Director of Community Partnership for the American Cancer Society, he is dedicated to forging strategic collaborations that drive cancer prevention, advocacy, and awareness efforts within communities. Jesus holds a bachelor's degree in biology from the University of Wisconsin River Falls and a master's degree in health administration from St. Mary's University of Minnesota. His career is marked by a passion for improving health outcomes and making a lasting impact on public health systems. Throughout his career, Jesus has developed a comprehensive understanding of the healthcare field, combining scientific knowledge with leadership skills to support initiatives that improve the quality of care and community engagement. So without further ado, I'll turn this portion of the Learning Circle over to Jesus. Thank you for joining us today.
No, thank you so much, Angela, for having me here today. I'm super excited to be here, a part of your learning circle here to kick off the year for everybody. But as Angela said, I am Jesus Barrera. I'm the Associate Director of Community Relation Partnerships at the American Cancer Society. And today, really, what we're going to be presenting here for our webinar is addressing cancer prevention and advocacy. And to get us started, I'm really going to give us a background of who we are at the American Cancer Society, what we do, what our purpose is, and really why we're here. And to start us off, this slide right here, anything we do here at the American Cancer Society, we take into account both of these things, our vision and our mission. And when it comes to our vision, it's to end cancer as we know it for everybody is our vision. And our mission is to improve the lives of people with cancer and their families through advocacy, research, and patient support to ensure everyone has an opportunity to prevent, detect, treat, and survive cancer. The American Cancer Society, we exist because the burden of cancer in our society is just unacceptably high. And to really get a bigger picture of how that national burden looks here in the United States, I have this graph here just broken down into two sections to really give you a good overview of how that looks like. Currently, there is an estimated over 2 million new cases of cancer a year, probably a little over. And on an annual basis, over 600,000 people unfortunately will succumb to cancer. And in both these sections, I just put a graph there to give you a better overview, really how that's broken down when it comes to both male and females, really when it comes to the cases that we get of cancer on an annual basis, and of course the death. Just the rates of death as well. And we have those broken up by different cancers to just give you a better insight of how the national scene currently looks. Here at the American Cancer Society, we have what we call a three-pronged approach to improve the lives of cancer patients and families. And at the center of that three-pronged approach is really equity in cancer care for all. And if we go through these prongs, I also like to call them pillars. The first one is what we call our discovery prong or pillar. And when it comes to discovery, we work with research breakthroughs in cancer prevention, detection, treatment, and survivorship. Here at the American Cancer Society, we work with over $450 million in grants. We are actually the largest private non-funder of cancer research in the United States. The only entity or organization or group that is ahead of us would be the United States federal government. But after that, we're second right behind. We also work in advocacy. That's our second pillar and prong. When it comes to advocacy, we really focus on access to breakthroughs in cancer prevention, detection, treatment, and survivorship. And when it comes to advocacy, we really work at every level of government, from local government, state government, and all the way up to the federal level. We're present in all 50 states in the United States. We also work in Washington, D.C., Puerto Rico, and also Guam as well. And the third pillar that we have is our patient support pillar. Our patient support pillar, what that means is we have direct support and education for cancer patients, caregivers, and clinicians. And with our patient support group, support pillar, we have around 79 million lives touched per year. And what I mean by lives touched on an annual basis, when it comes to direct support, when it comes to patient support, it's direct support in prevention screening, transportation. We have lodging opportunities as well for cancer patients if they need it, navigation, survivorship, and of course, patient education is a big one, especially for us here in our patient support pillar when it comes to educating our different members of the community, clinicians, and staff members alike. Next, I really wanted to focus on how community health workers really do impact that cancer care in our healthcare system. And to get us started, I wanted to really talk about really what makes a community health worker unique. Well, as this is probably not news to anybody on this call, but community health workers, they don't provide clinical care and generally don't have a professional license. Your expertise is usually based on shared culture and life experience with the people served. Community health workers rely on relationships and trust more than clinical experience and relate to community members as peers rather than purely patients or clients. All these traits that I have listed is a pretty big advantage in our healthcare system, especially when we start dealing with cancer, because community health workers can achieve certain results that other health professionals, such as nurses, doctors, NPs, social workers, can't produce and won't be able to produce. When it comes to community health workers and cancer care, community health worker intervention can improve cancer care delivery. Community health workers help advanced and reoccurring cancer patients with advanced care planning, substantially decreased hospitalizations, and emergency room visits, which is always a great thing. Cancer patients that are working with community health workers have reported higher levels of mental and emotional health, and that is especially great to hear, especially since a disease like cancer is not only physically taxing, but of course mentally and emotionally taxing as well. Cancer patients that are working with community health workers also do report greater use of using advanced care planning, palliative care, and also hospice care. Community health workers are also an extra set of eyes. Community health workers have both the positive and negative experiences of seeing the day-to-day impact that cancer has on an individual. Community health workers can help communicate questions and concerns to a patient's medical team. Community health workers are also can make navigating our healthcare system, which is complex as it is, a more comfortable experience, especially when it comes to survey to our underserved populations. And going off of that, community health workers do play a pretty big part in helping enhance health equity for those underserved communities here in our country. I wanted to continue on that topic of when it comes to underserved populations here in the United States. I wanted to highlight some cancer disparities that we are currently experiencing here in our country. To get us started, I'll lead off with rural communities here in our country experience higher death rates from lung, cervical, and colorectal cancers compared to their urban counterparts. And some of those factors have to do with poverty, health risk behaviors, and lower vaccination and screening rates. Socioeconomic status is a key determinant for cancer mortality as well. According to the National Institute of Health, about a quarter of all cancer related deaths may not have occurred if Americans were college educated. This last point will come as not a big surprise to many, but affluent Americans are less likely to die from cancer because of advances in disease prevention, early cancer detection, and certain cancer therapies benefit patients that had private health insurance more so than others that don't have access to healthcare or lack healthcare insurance. When it comes to cancer disparities, Hispanics and Asian Americans tend to have lower cancer incident rates compared to other US population groups. There might be a variety of reasons for this. When it comes to Asian Americans, reasons are still unclear and we're still unsure, but experts believe that it might be related to better treatment responses. For the Hispanic and Latino population, infected related cancers are overrepresented and more likely to be diagnosed with late stage cancer. And there are some correlations why Hispanics will be diagnosed with late stage cancer. A few factors when it comes to that is immigration status is something that is big, especially for a lot of people in the Hispanic community in our country. With without legal documentation and legal status in the United States, it is very difficult to get work that offers private insurance, which will lead to which leads to lack of healthcare access, which leads to being diagnosed with later stages of cancer. African Americans have the highest death rate from breast, lung, and prostate cancers here in the United States. And cancer survival between US race and ethnic groups show that disparities in stages at diagnosis may have the largest contribution to survival disparities. And that's what I was talking about 2 points up when it came to like the Hispanic community. It's easier to survive cancer if you can treat it and detect it at an earlier stage. And when it comes to socioeconomic factors and marital status are two other key contributing factors when it comes to survival rates for cancer. When it comes to marital status, the importance of marital status suggests that social isolation and stress may actually contribute to these racial and ethnic disparities. Private insurance provides the single most protective factor against being diagnosed with advanced stage cancer, as this is not a surprise to anybody, but private insurance highlights really the importance of access to healthcare in our country, and especially when it comes to reducing cancer survival health disparities among all United States population groups. Next, I really want to highlight two specific cancers and really disparities. I'll focus first on breast cancer. Breast cancer is the most common cancer for women in the United States, with the exception of skin cancers. About 30% or 1 in 3 of all new female cancers are breast cancer on an annual basis. Black women have the highest death rate from breast cancer. And to put that into perspective, at every single age, Black women are more likely to die from breast cancer than any other race or ethnic group. When it comes to white, Asian, Pacific Islander women, they're more likely to be diagnosed with localized breast cancer as opposed to Black, Hispanic, American Indian, and Alaskan Native women. And what I mean by localized breast cancer is when cancer is localized, it stays in one area of the body. And when cancer starts to spread and starts attacking different tissues and vital organs, it becomes much more difficult to treat. And going off of that, Asian and Pacific Islander women do have the lowest death rate from breast cancer due to that fact, because usually with early detection, breast cancer has not started spreading to other tissues or vital organs, and it can be treated a lot easier as opposed to when it's in later stages. Next, I really wanted to talk about prostate cancer. Prostate cancer is the most common cancer among men after skin cancer, but the good news, prostate cancer can often be treated very successfully. Prostate cancer is the second leading cause of cancer death in American men, just behind lung cancer. And to put it into perspective, about 1 in 44 men will end up dying from prostate cancer. Prostate cancer risk is higher in African American men and also in Caribbean men of African ancestry than in men of other races. And to put it into perspective, I'm Hispanic, and when it comes to men of the Caribbean that are Afro Latino like myself, especially in areas like Cuba, Puerto Rico, the Dominican Republic, and other Caribbean islands and nations, they are also at a higher risk compared to other racial counterparts. And when it comes to prostate cancer, it does occur less often in Asian Americans, Hispanic and Latino men, other men than in non-Hispanic white men. And again, with the exception really when it comes to the Hispanic community, Afro-Latinos such as Cubans, Dominicans, and Puerto Ricans, they will be at higher risk for getting prostate cancer as opposed to other Hispanic ethnic and racial groups. Next, I really just wanted to get a chance to really highlight some things regarding health equity and as well some opportunities in our healthcare system for CHWs. One thing I really wanted to highlight when it comes to cancer prevention that community health workers and other healthcare professionals can do is really focus on what we like to call modifiable risk factors. They're also known as lifestyle related risk factors. When it comes to cancer, there are certain things that unfortunately are out of our control. Your race, your gender, your age, your genetics, those are risk factors that we are born with, and often we have little to no say in what we can do. But there are some lifestyle risk factors that we can take control of and help reduce our risk of cancer. The first one, really, it's physical exercise. Really, to lower our risk of cancer, it is recommended to engage between 150 to 300 minutes of moderate intense exercise or 75 to 150 minutes of vigorously intense physical activity per week. The second factor, excess body weight, keeping weight within a healthy range and really avoiding weight gain as an adult. There are Obesity is a huge killer in our country. It's no secret obesity is linked to many, many chronic illnesses and disease, and cancer is no exception. This last point when it comes to drinking alcohol is a little outdated, and it's outdated by around a week. I say that because the Surgeon General of the United States and also the World Health Organization is really changing their verbiage when it comes to drinking alcohol and cancer risk in order to really prevent cancer risk. Now, the Surgeon General of the United States is saying that just there is now a pretty substantial correlation of drinking alcohol and getting and developing cancer. Drinking alcohol of any kind, of any intake level increases your chances by a moderate risk of getting around 7 different types of cancer. So this before it's said to really avoid alcohol to limit it to 1 drink per day for women and 2 drinks per day for men. But now that's going to be changing here in the near future for us here at the American Cancer Society, and there's already some research behind that. And it's been all over the news, so I highly do suggest that you do check that out. It's been pretty interesting to read, quite frankly. Next, I really wanted to talk about how community health workers contribute when it comes to promoting health equity. Community health workers provide a community perspective when it comes to local, state, and national public health policy. Community health workers get a chance to provide education and interventions with members in their own community. Community health workers work with different community partners to help spread awareness and achieve different health goals. And lastly, being able to build advocacy coalitions and put the power and the tools in the hands of communities that are most impacted by health disparities and disparities in when it comes to cancer treatment and cancer care. I briefly also wanted to highlight just some community health worker career opportunities. Employment for community health workers is projected to continue rising it's estimated from 2023 to 2033. It's projected to grow 13% employment for community health workers, which is a lot faster than the average occupation, according to the United States Bureau of Labor Statistics. Unfortunately, cancer is not going anywhere. There was an estimated over 2 million new cancer cases just this past year in 2024. And with cancer incident rates still being so high in many different health systems, different organizations, community health workers are now being integrated into cancer care teams, especially in areas there's high cancer disparities, especially due to all the success and all the benefits that community health workers do provide for patients that have been diagnosed with cancer. As I mentioned in my first few slides, all the benefits that community health workers bring to a cancer care team and to their patients. I wanted to highlight, I can definitely speak on behalf of the American Cancer Society at the moment. Currently, we do not employ any community health workers in Minnesota, but the good news is we here work with so many grants and funding opportunities that there are possible opportunities here in the future. I know other states have worked in our organization, have employed and worked with community health workers, but here in Minnesota, we still have not. But as I said, there are definitely possibilities, and the need for community health workers is growing, especially in cancer care teams. For us right now, the American Cancer Society and the Minnesota Community Health Worker Alliance ship partnership is a priority for our community impact team and for our advocacy team. Healthcare keeps facing increased pressure and incentives to address population health, and community health workers are in a very unique position due to their expertise, their day-to-day work with patients to really be able to bridge our healthcare system and also public health. This page, I just really wanted to highlight just some resources that we have. If you need more information when it comes to general information, education, cancer screening, cancer statistics, you can visit our website at cancer.org, or you can also call our 1-800 number and you can talk with one of our cancer information specialists. They are very, very well-informed people, and they can definitely guide you in the right direction if there is a specific resource or a question that you might have. And we offer services as well in different languages as well if you do need the call. For me, that is it, what I had today. I will now open this up for questions if anybody does have any questions about anything that I presented or anything regarding the American Cancer Society or anything that I talked about. I can definitely open it up for questions. And if you would like to unmute yourself or put them in the chat, I can definitely take a look at that as well.
Absolutely. We have officially opened the floor for questions, comments, feedback. We welcome that here.
Please.
I always like to give a little moment or two before I
Oh, no,
start talking
absolutely.
because I
And
can
don't
be
be,
a chatterbox sometimes.
no, don't be shy. I get sick of listening to my own voice. So if you do have questions, please fire away.
Okay. Thank you so much, Jesus, for this informative and thought-provoking um information that you provided. And my mind is, I'm a processor, but my mind is just like churning with thoughts and different things like that. So I can see how CHWs can play a vital role in the healthcare systems and with patients with cancer diagnoses or even in preventative care.
Absolutely.
And so seeing that, I can see us just putting this out there for us is around, I can see us being utilized in education and awareness for prevention, early detection, even providing cancer information in a culturally or communal relatable way to those that we serve. I can see us doing patient navigation, accessing care, or referral assistance because sometimes things could get lost in the shuffle, especially in big systems or for the most vulnerable populations that we may be providing services to. I've had some prior experience with emotional and social support for the patients and caregivers When I was navigating home health system, I was in another title, of course, but I'm always carrying my CHW banner. I can see us in treatment and adherence, treatment plan and adherence. I was just writing as you were talking, and it's just inspiring me, like, as we're moving forward to this even to be, acknowledged and that we are being utilized. So even if organizations are not formally hiring us, we're knocking at the door. We're just waiting for the open up the door. So we need to seek those collaborative partners and that support for CHWs all around. Because, I mean, I'm thinking about. I wrote it on resource connection because that's what we organically do in our scope of practice. Support groups. Because we can do wellness support groups and support groups for the patients as well as families and caregivers. So we need some collaborative effort, advocacy, and empowerment for our patients. Helping the patients get educated to empower themselves to self-advocate of what they would like and vision in their healthcare, patient advocacy, and just um, health disparity reduction and more. Like there's so many potentials. Um, have you encountered CHWs working in clinical settings or how? Oh, could you share that? I am so inquisitive
No,
about that as well.
you beat me to it, Angela. I was actually about to actually comment on that. I work with, even with a brief background about my role, I work with a lot of different FQHCs and health systems across the Twin Cities and greater Minnesota. And actually, two of the FQHCs I work very closely with in the Twin Cities, they do on their staff have community health workers that are out there in the community that are full staff members, just full-time staff members that's their role to really be able to go out there and really provide patient education and really, especially when it comes to not just cancer, but other health conditions as well. But in my role specifically, the community health workers I work with, they're focused strictly on cancer. And this particular group that I'm talking about, prostate, this organization, that's what their community health workers are. And I think the opportunity as well is there, Angela, because, and this is the feedback I've gotten from health systems that I work with, a lot of clinicians have a lot going on. And I think at times, to be completely honest, and it's no disrespect to them by any means, but they just a lot of the times do not cover this material when it comes to cancer prevention. And that's something that my job is I work in quality improvement with these folks, and a lot of times they really just have so much other things to cover. Even then, it's really even being able to even teach patients and members of our community to self-advocate, because quite frankly, that's not always going to happen when you do go see a physician with so many things to cover. And I think community health workers, as you said, Angela, really do play a big role in that, and really even being able to help your our own community members to really use their voice and make sure that they're able to seek adequate treatment and prevention care as well.
Absolutely. I mean, we're grassroots, frontline healthcare professionals. And
Absolutely.
so we also have those connections and those commonalities um, and to bridge those gaps in those disparities and address those health targeted health areas in that spectrum of care. Thinking about my mind is just all over the place. Pardon me. I don't want to. I'm gonna go into the chat. So we have thank you for the information. We have a few of those. It was great information. We have a comment. Does the ACS provide support groups for people newly diagnosed with cancer or for cancer survivors?
Yeah, that and thank you for that question, Jen. And to answer, it's a two-part question. Does the ACS provide support for people newly diagnosed with cancer or cancer survivors? The answer is yes to both of them. When it comes to newly diagnosed cancer patients, actually that hotline number that I gave, if you call that, our cancer information specialist will actually be able to provide you a list of different things that we do provide when it comes to patients that have been diagnosed. One big thing that we also do provide as well is we do have social workers, and we do have mental health like specialists that do work as well, because as I mentioned earlier, mental health is a very, very big part of this as well, especially when you're recently diagnosed with cancer. That's feedback that we as an organization have gotten for many, many years. So that hotline is actually available 24/7. So if somebody has been diagnosed with cancer, they can reach out and there will always be somebody there to help and be able to answer any questions and really be there, especially as a supporting to be there for support. So absolutely. And for survivorship, yes, we do a lot of work with survivorship as well. In my role, I'll be honest, I do a lot of things when it comes to prevention, education. I do some work with survivorship, but a lot of my other colleagues, that's more of their area of expertise, and that's what they do. But yes, we do a lot of work with survivorships, being able to check in with survivors, and we really even with our rideshare program, even helping patients taking them to follow-up appointments, really check. We do a lot of other things as well when it comes to survivorship. So absolutely. And I kind of started answering the second question there in the chat, but if I do any preventative care work in Minnesota, and my answer is yes, that is the majority of my job is education and preventative work, really. I work with different health systems, different um, different FQHCs, different work groups. I'm a part of different coalitions, and really my job is really similar to what community health workers do, is really to spread awareness and education when it comes to not just community members, but I also work with clinicians, with nurses, with healthcare directors and managers on really making sure that we are able to increase screening rates for all different types of cancer, making sure that we are able to decrease cancer rates, especially within certain organizations. That is really my role. So preventative care is essentially, for lack of a better term, is a good chunk of my role. So yes.
And just in case we have any students or new CHWs on the call, can you please
Yes.
explain to our CHWs what is FQHCs?
Oh, of course. I'm so sorry. I know that that's something that I'm just so FQHCs are federally qualified health centers, and essentially in Minnesota and every different and in all states, federally qualified health centers are organizations here in the Twin Cities that I specifically work with that treat treat patients really that do not have insurance, work with underserved populations, and really that is the purpose of them, is really to make sure that people that do not have access to healthcare do not are able to go see a provider. And here in Minnesota, gosh, that number, at least here in the Twin Cities, that number's at around like 8 or 9 across the state. I think it was like 16, but two of them might have closed. So I apologize. I think the number it was at 16, but I think we're down to like 15 or 14 because two of them I don't think are in service anymore. But yes, every state has some sort of a federally qualified health center presence. Here in Minnesota, they're mostly here in the Twin Cities. I work with pretty much most of them, but there are some as well in greater Minnesota, but that number is not, that's again another challenge with rural health that we are experiencing.
Absolutely. So you'll definitely have run across CHWs in your time.
Yes, I have, especially working with the FQHCs I have. It's been a pleasure to work with a lot of them. They're very great people with just a just great driven mind and want to help people. And like I said, it's it's a unique advantage to be able to see the day-to-day progress of somebody, the ups and the downs that nurses, doctors, they're not privy to that. They see you for 30 minutes, an hour. You get to see the brunt of it as well as a community health worker.
Absolutely. Yes. And Miss Peggy is on the call and she said North Point Health and Wellness is a FQHC.
Yes.
If you want to come off mic or mute, Miss Peggy, please let us give a plug for North Point and how they utilize CHWs. And if you utilize CHWs in some format to address cancer prevention or cancer care.
Yes, yes. Thank you so much for that. Thank you for the presentation. Great information.
Of
And yes,
course.
yeah, North Point has been around for over 55 years. So they were the pilot city. So when they first had these SPCs, I can't even say it correctly, but they started with North Point, and we've been around, and we serve the community in so many different areas. I work at the actually not the clinic, but the human services. So meeting those other services as far as referrals for, if they're looking for something, eat, housing, and just resources. We are the connection. And we utilize CHWs in multiple ways. We have the navigators for Mensure there. We have dental department. We have some assistants that are CHWs, as well as we also have, I think we have, just recently it's been well known that interpreters we have, and then we do all across the board far as clerical work, far as secretarial, assisting, being there with the doctors and making sure we educate the patients. And we continue to grow. And we are continuing to do a great work. And I just know that we make a big difference, because when it comes to a lot of us, our community that are not insured, we have discount insurance where that our patients are, they can actually make sure they get the help that they need. So it's a big umbrella, but we figure it out, right?
Yeah.
Get the work done. So yeah, it's a lot of work out there and a lot to be done.
Well, thank you for sharing, Miss Peggy, and thank you to your team and everyone that's doing the wonderful work there at North Point Health and Wellness. That's kind of like a little bit of my alma mater, kind of, because I did some of my training when I was a CHW, right in the in the lower level of health, North Point. So, yeah, so I always have a rooted connection there. But I appreciate that. And if anyone else has any questions, feel free to pop them in the chat. We don't want to exclude you out of the conversation, or come off mute and join the conversation if you have any questions or feedback. The only I had kind of in my last little question is, I've just been thinking about potential titles and roles that CHWs can play, but also the clinical settings where CHWs could have a focus, could be a provider in that focus area. Jesus, would you have any idea of that?
Yeah, absolutely, Angela. And this was something that I actually spent some time researching because I was curious myself while I was doing this. And when it comes to community health workers, it is in all different types of when it comes to outpatients, so primary care clinics, hospitals, even nursing homes are community health workers are starting to be employed really when it comes to because when it comes to cancer patients, we find cancer patients at all different levels. The only time, and of course, even home health care, that's something that, but for me, what I've really seen a commonality is in large healthcare systems, in hospitals and primary care, we are starting to see some CHWs. And like I mentioned before, I work with several FQHCs, and actually, Peggy, I work with North Point pretty closely as well. Ironically, that you mentioned that. I have some folks there that I work with, but we do with FQHCs, primary care. So at this point, like I said, I can't really speak for every single organization, but we are starting to see in pretty much in any healthcare system that we are seeing. I can't speak to when it comes to hospice and things. I have not really, do not have any data or even just experience with folks to back that up. But every other healthcare or setting that I've mentioned, there, yes, we're starting to see CHWs, which is awesome to see because it's great to see that the value of community health workers, it really is when it comes to especially reducing healthcare disparities, it is absolutely an awesome thing to really include in our healthcare system.
Yes, I'm elated about that. We are on the rise, and the momentum keeps moving us up. And to close us out, if you could talk a little bit about how CHWs could get involved, engage, or learn more about how to support um cancer care, cancer services at, I know you mentioned that there was a local, a state, a national, and policy arena for all of that. Can you kind of touch? I'm a little interested about that too.
Yeah,
No,
absolutely.
I'm sorry. I know I've seen some CHWs before testify of the
Yeah.
ACS, and so can you talk a little bit more about that?
Yeah, absolutely. I can speak with our organization. We have an umbrella of the American Cancer Society that we call ACS CAN, which I know Angela's familiar with. It's called our Cancer Action Network. When I was talking about advocacy, well, ACS CAN, our Cancer Action Network, is is really the umbrella of the ACS that goes and works specifically. All they do is work with policy. A lot of my colleagues that work at ACS, they spend a good chunk of their time here at the state capitol in Minnesota. They also lobby in Washington, D.C. as well. And to Angela's point, when it comes to testifying, we work with so many different groups. I'll give an example. In October, here in Minnesota, we made medical debt something that cannot be passed on to a spouse. That was something very, very big that happened in October that Governor Tim Walz signed into law. That is actually something that the American Cancer Society worked very closely with a close partner of mine, Cancer Legal Care, in order to make that happen. And that was ACS Can lobbying and listening to stories when it comes to everyday people. And that's something that really that's an advantage that community health workers have. A lot of times, people that are in upper echelons of power, they don't really get to see the day-to-day suffering that normal everyday Americans have. CHWs really do have the opportunity to really testify and firsthand bring those issues to attention. And that's just our organization. And previous organizations I've worked with as well, there's always a chance for advocacy or really getting a chance to speak about a certain issue. That is definitely something that can be brought front and center. So that is something as well that I would highly recommend. If there is something in just even in your healthcare careers, there is always a way to really bring that into attention. And I'm not just saying that from the ACS's lens. I'm just talking about in my short 10 years of healthcare, I've seen that being able to in different organizations. So I absolutely, absolutely, please, if there is something, please continue to advocate for it. There are ways to bring that, even reaching out to just your local congressman, senator, state, or federal. That's even a way to even get that started. Absolutely.
We have Jen shared in
Sure.
the chat box a link, information, of one of the programs that they're a part of, and for CHW Knowledge, and it's for
Is it
the
Sage? It
Sage,
looks like.
a link to Sage.
Okay. Oh, very nice. Yeah, we work very closely. I personally even work very closely with the folks at Sage at the Department of Health, and they have a lot of great information, especially when it comes to can. Yes, absolutely. Sage is definitely, for those that don't know, the Sage program here in Minnesota really helps with just women's health when it comes to getting cervical and breast cancer screening, especially for low income and just and underrepresented groups. They have a lot of great knowledge and really a good resource for anybody that does need that would like to get screened or needs anything for like education. They are also a wonderful, wonderful organization which we work closely with. So absolutely.
Thank you for the details,
Th-
and thank you for the resource, Jen. We really appreciate that.
Yes, absolutely. That's an awesome resource. Thanks for sharing that, Jen. That is extremely helpful.
Yeah, thank you for the presentation. And just when you spoke earlier, Jesus, about access to insurance and the cost, I've worked with a number of people who have insurance, but, I have a $20 copay that I can't afford. So yeah, I just wanted to also share we serve a large percentage of the women that use our program are undocumented. So
Wow.
just wanted to make sure to put that out there as well. So there is a phone number on our website that you can call and You have 4 different people, 2 are native Spanish speakers that can answer questions if someone qualifies and also provide referrals and other information. So thank you. I really appreciate this topic though, and it's awesome to see the work you're doing, Jesus.
Oh, well, thank you so much, Jen. I greatly appreciate, and thank you so much for really sharing this wonderful information and just being here. We greatly, greatly appreciate you just getting a chance to share your expertise and your experiences as well. It's important for all of us to hear from one another. That's how we learn and really make our healthcare system run a little better and hopefully a little more efficient, even if it's one step at a time.
Absolutely. And that's just hits on all of the objectives of the circle coming together, making those connections, building those networks, building those relationships,
Mhm.
filling in those gaps of knowledge and sharing and resource building amongst each other. I really, really appreciate that. It's been a wonderful session. I'm gonna stop our recording now.